Hello, I'm Dr. Jason Moore. Today I would like to tell you about some common causes of spinal arthritis and some of the most effective treatments for this condition. Spinal arthritis can be caused by either major or minor trauma. What happens is that when there's an injury to your spine, and especially if it's not treated properly, you're much more prone to having degenerative change over a period of time to whatever area of your spine that you were injured in, either your neck or your lower back, and make that area much more prone to having some spinal degenerative change. In spinal degenerative arthritis and change, what typically happens is that the discs in between the vertebrae in your spine, there's discs in those areas made out of cartilage between the vertebrae. What happens is that those discs lose any water that's in those areas, become stiff and brittle, are more prone to injury, and basically they degenerate. And what will happen is that the vertebrae tends to compress those areas and cause a lot of pressure. You can get bone spurs in these areas. The holes where the nerves come out of your spine typically get smaller and can cause pain and irritation that way. So that's what happens when the patients get spinal degenerative change. Now, some of the effective therapies that we use for this condition in our office is what's called the chiropractic adjustment, electric stim in our office, mechanical traction. What we do with the spinal adjustment is very safe, effective, gentle therapy that we use to gently mobilize and increase the flexibility of the problem area where the degeneration is taking place to help increase its flexibility and mobility. We use the electric stim. That's basically a very light electric massage to the area. We apply that to the muscles and the skin in the area to help reduce inflammation and irritation, help to get the muscles to relax, thus alleviating pain. We also use what's called a mechanical traction. We put the patient on a table, a very light massage roller comes up, and basically what that does is it helps increase the flexibility and pushes against the vertebrae in the spine, taking pressure off of those discs, and help treat this patient's symptoms that way. When patients have degenerative change in their disc, they're typically going to have symptoms such as that we effectively treat is pain in the area. They'll notice stiffness and decreased range of motion. They'll notice, especially in the morning, they'll also notice muscle spasms in the area. And we use these therapies to effectively get you out of pain and help increase the mobility and flexibility of these areas. When patients receive treatment here at office, typically they tell us that they're able to work better for longer periods, better flexibility and range of motion at work, and able to perform there much better. They also tell us that they're able to sleep much more comfortably rather than toss and turn all night with pain. They get a better quality of sleep. And they're also able to basically take care of themselves better. You know, simple things like putting on your clothes in the morning, putting on your shirt, getting dressed and ready for work in the morning. They're able to perform all those better when they receive treatment here at our office. If you have spinal degenerative change or arthritis and are suffering from pain, give us a call. We can help you at 304-523-7891.